Hi, everyone, and welcome to another session of the Seamless Connection podcast. I am thrilled this morning to have with us Dr. Raghu Adiga, CEO at Liberty Hospital in Kansas City, Missouri. Dr. Adiga, thank you so much for taking the time to meet with us today.
Thank you, Mina. Thank you for inviting me. It's my pleasure.
I'm thrilled to dive into it with you. I guess first to start off for the audience, can you give them a little bit of your background from kind of your entry into healthcare and all the way to now your current role as CEO of Liberty?
Sure. Well, I'm from India. I was born and brought up in rural southern India in a lower middle class family. And like any other family in the wider world, my parents were, mostly interested in good education for their kids. And that's how I ended up, getting my good education, which is pretty common in India, and was the beneficiary of that, and went to college in India, did my med school there, and ended up here in US at the age of 24. And so things happen. Fast forward, I find myself now the CEO of a mid-sized hospital here in Kansas City area in Liberty. I did infectious disease for a number of years as a practicing physician, and did chief medical officer for a few years as gaining experience in leadership, and took over as the CEO about a year ago.
No, that's great. You and I have talked a lot in the past about adaptability and how that's important on both a personal and professional level. I know there's a lot of personal first for you within your family, within your professional career. Can you talk to us a little bit about that and help the audience understand, where adaptability fits in and how important it is personally and professionally to get you where you are?
Yeah, of course. Yeah, I do strongly believe. I think change in anyone's life is certainly going to happen. It's a question of when, and how do you adapt to that change. Tells you how successful you become, and I strongly believe in that. And the personal story, I think, does support that as well. And obviously, I grew up in in a lower middle class family, and nobody in my family had even gone to college or let alone med school. And so I was able to do that. And then I'm the first one in the family to speak English. I didn't actually speak English until I went to med school, and first one in the family to actually even fly out of the country to a different country. So the change when I arrived here in US at the age of 24 was unmistakable, as you can imagine. There was no family members, there no friends, so to speak of yet. But that's the story of a typical immigrant in this country, the first immigrant who comes here. And those who become successful are the ones who adapt to that kind of change. So it was good personally, and I was able to get my residency and fellowship training, and got interested in infectious disease. It's a specialty that I fell in love with, just with a mentor who showed me, what you could do with it and how you can change people's lives. That was very interesting. So went into infectious disease, and again change. I needed a visa a change for me to stay here longer. That brought me to Missouri, and again another change coming from Chicago to a small town in Missouri. And I didn't think I'd be here this long. That was in 1997, and this is 2023. I'm still here in Missouri. So you have to adapt and evolve to the change, and change is good. So I was able to, grow professionally, and be able to, change to, say, from clinical world to leadership role, and CMO, and now the CEO.
I
So
was going to ask you about that because that's
yeah,
a big change from practicing clinically, which I know you loved, and being part of a thriving ID practice, to becoming CMO and then becoming administration of the hospital to now being CEO. Did those kind of just naturally fall in? Were those positions you actively looked forward to, kind of stepping into? And if so, would love to get some thoughts as to kind of what drove you on both of those.
yeah. A lot of us in healthcare, especially physicians, don't always think of administration and leadership roles. Most of us are what's called accidental leaders, and maybe you can put me in that category. However, you don't take up those positions if you don't have interest. So it so happened that I was asked to be the chair of the Department of Medicine and then be the chief of medical staff in the medical staff leadership world in this hospital. And I liked those roles. And in 2016, that's when the hospital needed somebody from the medical staff to take a leadership role in the hospital. They did not have a CMO or anybody in this hospital at that time. And I also had some personal need to potentially, change my career. I was just going through a divorce, and I had a couple of children that I needed to spend some time with. So I thought I needed more control on my time. And it was difficult in ID practice. Going home at 8 o'clock, 9 o'clock at night was a little hard on the kids. So it fell in place, and I thought, okay, let me try. And I started loving it. And so that's where you are. So continue to grow in that field. And I did realize, though, the interest in clinical practice is mostly what we feel that we can make a change in someone else's life, and that's what gives you a huge positive reinforcement. And I realized that being in leadership, well, you can still do that, and you can do that a lot more than what you were doing as an individual with an individual patient. So I started liking that, and I think my career went in that direction.
Yeah, and definitely, we've definitely heard a lot of guests talk about the scale of impact, right, and wanting to make a bigger impact with what power that they have and the resources that they control. So now, as CEO, how has that changed? And I'd love to kind of understand the difference between from a CMO perspective to a CEO perspective, because I don't think people really understand the nuances there, other than one is clinical and one is more business focused. But you're both. So how would you describe the difference from your time as CMO to your time as CEO? And maybe if there is a difference dramatically, the impact you're able to make from one role to the other.
Yeah, so the CEO position obviously involves a lot more than the clinical side of things. As you mentioned, I think the business part is the most important one. And now I find myself responsible for 1,900 employees and a large patient population that we serve here in northern part of Kansas City, Liberty area. And the hospital itself is in a good path for growth, and that's a responsibility of the CEO to lead that in that direction. And there are a lot of positive things going on, and obviously a good realization is that it's just not the CEO, it's the team that makes a huge difference. And I walked into a leadership team that was exceptional in a lot of other areas that, we physician leaders find ourselves, or at least think that we are not that good at. Take, for example, finance or, certain operations. But I've got really reliable leaders in those areas who certainly help. So there is a difference between CEO and the CMO in that regard. You're responsible for making sure that we stay within the budget and make plans for the future growth while not necessarily losing certain service lines. And that's where I think the CMO experience comes in. I have the intimate clinical knowledge of what works and what doesn't work. So I can bring that into my C suite and have a good discussion on, there is a certain service line that may not be as financially productive, but it is essential for the hospital or for the community. So we figure out a way to keep that going. So those are the kind of things that help as a CEO. But certainly it's on the job learning experience, no question about that.
Well, one thing I wanted to ask you, because you basically became CEO in pretty much the most challenging time to ever be a hospital CEO, I think. So props to you on being so successful at it when you did that. How has it been for the last year and from 2021, 2022 to today? If you can just give us a little bit of context for Liberty. Liberty is very unique. It is in that it's one of, the last remaining, if I can be hyperbolic in that way, maybe independent hospitals. I know a big part of what you're working on is, what is the best way to have Liberty meet the needs of its community, whether it's independent or not. And I know that was a big point for you as you took over. Can you talk to us a bit about steering a hospital through the challenges of COVID? And then how do you look at it now going forward with, we've lost all the COVID funding, growth is coming from different areas. The government hasn't exactly fixed the funding issues that we have with CMS. So how do you think about all of that? And then how do you look forward from a hospital perspective?
Yeah, that's a very interesting question indeed. Of course, like many other organizations, ours has been tested during COVID, no question about that. Our resilience, our adaptability, and our capacity to manage change certainly has been questioned. And obviously, we had to make some critical decisions in real time during COVID, and we had to collaborate across varieties of sectors and improve the communications after all. And so the pandemic actually served as a catalyst for this kind of transformation, and it fostered a certain culture of needing to keep on with continuous improvement and preparedness. To me, I think it helped being an infectious disease physician, and I was the CMO at that time. So I still remember the day when my then CEO called me in to have a discussion about the pandemic. And this was like in February of 2020. And in January itself, I was sending out emails to my physician colleagues about, oh, I hear about this novel coronavirus in China. I don't think it's going to be an issue for us, but I think we need to look at these things. So anyway, it really grew to a point where we needed to have facilities response, and we had to set up an incident command. So I agreed with him, and we sat down to discuss details. And then he goes, "We need an incident commander." So I'm started to look around the room, looking at leaders. Who could be the best incident commander? And then he looks at me and says, "Well, I know of a physician who's an infectious disease physician and a CMO. What about that?" So that's how it ended up falling on my lap. But it was certainly an advantage. We had a great team, a very seasoned team here, and my infectious disease background also helped in communicating with the other healthcare facilities in Kansas City. So the chief medical officers of other hospitals, we all got together periodically, almost once a week, and where I felt my input was taken seriously. And so we were able to collaborate a lot better with other hospitals, other organizations around us. So that was a good background for dealing with change and how to manage crisis. That certainly has helped me in the CEO role now as well.
No, and that completely makes sense. In terms of specific examples you can think of that you found or that you thought Liberty needs to change, and these are changes you've made as taking over, can you talk to us about anything that comes top of mind or that you consider a key success as you kind of work towards getting Liberty facing the needs of the future?
Yeah, of course. I mean, there are a lot of different areas that we've, brought change. Just to give you an example, telemedicine. I mean, that's been pretty common everywhere, but our system was a little bit slow to adapt to that. I can remember one of our own primary care physicians who is actually very good in tech. He'd been talking about, oh, we need to be doing more in telemedicine, but we had not really moved in that direction a whole lot. And of course, when the pandemic hit, there was an urgent need, and we moved fast to start doing that. And I remember him calling me and telling me one day that, wow, finally we are there. I can't believe it took a pandemic for us to get there. But that's just an example. And of course, we were it's mostly the process change. A lot of approvals and policy changes would take weeks to months, but we can do that so much quicker now. Even today, there is still supply line issues that frequently come and bother us, but we can think ahead and be prepared for those kind of changes. And of course, technology overall, I think we are a lot more receptive. And I know AI is coming, and we need to be ready for it. And those kind of things, I think we are better prepared.
So, in terms of just from an overall hospital CEO perspective, it sounds like change management, process change, all of that, and getting kind of team buy-in, it sounds like, is a big part of having successful program change. Is that something that there's lessons and takeaways that you can pull out for other hospital CEOs or other hospital leadership to take away of hey, this is how, maybe without a pandemic forcing you next time, this is how you get successful change in a hospital, which, as we all know, has a lot of stakeholders, has a lot of people that need to weigh in before real change can be made.
Yeah, of course. I mean, I think this is again a matter of communication and collaboration and making sure that all the stakeholders have a buy-in. But that needs to be done as efficiently and quickly as possible. The more time you spend on making a decision, there is always competition, and you lose your relative advantage. So certainly we need to do that. The other thing in healthcare that certainly is happening in addition to advances in tech is how the consolidation is taking place in healthcare, because the scale certainly is important. If you look at it, there are a lot of other industries where if you, if you look at 25% of, or just take 25 large companies in any other institution, say airline or banking or something, they control nearly 75% of that industry. But if you look at healthcare, if you take 75 of those, they only still control less than 25% of healthcare. So there is a lot more room for consolidation. And you're going to see that a lot more and more over the next few years. And we are certainly seeing that already in Kansas City market.
What
Um,
do you think is driving that? Like, what's the benefit or what's the upside in consolidation versus why would a hospital want to consolidate?
yeah, so I can give you from my own example, and certainly each institution has their own reasons for it. In our case, there are a lot of positives for being a medium-sized or a smaller hospital. That is, we are very nimble. We can make decisions a lot quickly. We can make local decisions, and we have this personal touch in our healthcare that we are providing. All of those are positives, but there are negatives. The negatives are resources and being able to grow and bring the economies of scale to what we do. So I am already foreseeing a lot of needs that we have for us to grow with the community that we have around here. So, for example, we need to be able to put a lot more resources into opening more new clinics, bringing technology into it. For example, our EHR, we really need one EHR across the entire platform of clinics and hospital. We have 15 different clinics that we own. So we need to be able to do that with the EHR so that there is, not much inefficiencies that are currently there. So we need to get over that. And then, of course, talking about other technologies, whether it's telemedicine platform, being able to bring in additional services through telemedicine, or even for that matter, AI. And I do anticipate in the next 5 years, there's going to be a whole lot of changes that AI is going to bring. And the bigger health systems have a leg up on us. And we'll be way behind if we are slow to adapt to those kind of changes. So I think having a good partner with whom we can work with culturally, that's a good partner, and will continue to maintain our this personal touch that we are talking about, the culture that we have developed. If we can continue that along with bringing these resources, it's a win-win situation for everybody. So that's the main reason for us, and I'm sure other organizations such as St. Luke's, who just announced their partnership with BJC Healthcare. Those are two large health systems in Missouri. They have their own reasons like that, and I think given our population growth that's happening here in the Northland and the healthcare that we provide all the way up to Iowa border up here, and rural medicine. We truly have an opportunity here. So it's getting at the opportunity before it's too late.
And a big part of what it sounds like is driving, at least from your perspective, the consolidation attractiveness is the access to additional resources, whether it's to bring in telemedicine or new platforms, new technologies like AI, and then being able to put that through. Is that a fair assessment?
Yeah, that's one of the major reasons, certainly. And the access is not just the capital; there is also, additional specialties, and being able to, for example, research that happens in big academic institutions, and there is a lot of benefit that comes out of that, whether it is a personalized medicine, whether it is clinical trials. We want to be able to provide that right here in the Northland without for these patients having to travel a whole lot. That's an interesting story. When I came here to Northland, there is a Missouri River between downtown Kansas City and Northland here. And the patients always hated crossing the river to go to downtown to receive their care. It doesn't matter there are 5 bridges across the river, but still they like being here and receiving their care here, and we'll be able to do that. So that's what I'm looking forward to.
That's great. Where, if you can describe kind of the region, I know Northland's grown a lot, both in terms of population as well as in terms of needs over the last kind of even the last few years, but especially over the last decade. How big was it when you started, and what's the patient catchment area and profile now?
Yeah, I mean, it certainly has grown. I mean, for example, the couple of counties here, Platte County and Clay County, those two are the counties here in the Northland. In the state of Missouri, Platte County is the fastest growing county in the entire state, and Clay County is the third fastest growing county. So there are a lot of new businesses coming in, and the population growth purely because of other potentials, such as the airport. We have a new airport now, and you are able to access any big city can access. People in big cities can access and still have a cost of living that is remarkably better. I'm talking to somebody who lives in California, so
I was gonna say, you need to preach to the choir here. Yep.
so the population growth in our catchment area has been, I would say, in the last at least 10 years, I would say it's gone well over 5 to 10%. If I had to guess, it's been growing.
Yeah, 5 to 10% a year. And one thing that I found unique when I came out to visit was just the wide variety of patient types and kind of clinical needs that you're facing. Like you mentioned earlier, you're seeing patients and your clinics are treating patients in rural areas all the way to a major metro area like Kansas City itself. So how do you set the system up? How do you set Liberty up to meet the needs of such disparate populations when resources might be different from clinic A to and in the rural part of Platte County all the way through to downtown.
Yeah, so you're right. I think we need to be prepared for servicing all sorts of patients here. The location is a suburban location, and we do have a lot of those patients. However, as you mentioned, to the north of here is a large agricultural land all the way to Iowa, and there are some smaller feeder hospitals to the north of us who do send patients to us. So we need to be able to provide care for all of those, and we do have clinics, spread out in several different areas. So we need to be able to provide care either directly and also on the long run. Certainly, we will be considering offering some sort of teleservices, especially with our specialists. It would be nice for them to go there to the far off clinics, but as you know, as the specialists get more and more busy, it's really hard for them to find time to make these kind of in-person visits. And I anticipate eventually we'll be able to offer those kind of services to outlying clinics and also to feeder hospitals. And yeah, it's certainly there are a lot of disparities in healthcare delivery. We are not unique to that, but socioeconomic conditions and of course, like anywhere else, language barriers and cultural differences do play a role, and we need to be prepared for all of those.
No, that makes sense. In terms of kind of, there's a lot coming up in the next 5, 10 years that you're working on, that you're laying the groundwork for, which, there's you're not biting off a small amount here. What are you most excited about for 2023?
Right now, for our hospital, certainly we are, looking at good partnership search, and I do anticipate it's going to be great. We are going to find a partner who's culturally the best fit for us and will help us grow exponentially here. And on the long run, beyond 2023, certainly I do feel that there are bigger things that I hope we'll be able to address, just like with any other healthcare facilities. I want to be able to grow physician leadership. Having been through that, I recognize clinicians are in a unique position to help the healthcare delivery get better, especially to people who need them. There is a lot of misaligned incentives in healthcare. It's not one person's one person is not going to be able to do that. I'm hoping that on the long run, there's going to be a concerted effort in the United States. We spend 18% of our GDP in healthcare, and we don't really have a whole lot to show for it compared to a lot of European countries. There is a lot more that we need to be able to do. Technology is coming, and I think if we get good leadership, especially clinicians, into that, we can do it. So I'm thrilled about the future, what we can do in the next 5 to 10 years.
That's awesome. And then from an independent hospital perspective, and also just a key resource in your community perspective, what keeps you up at night? What gets you worried? What has you concerned that, hey, we have all this potential ahead of us. There are all these amazing things we can do for our community, but this, and whatever this is, it's one thing, it's three things, are the things that put that in jeopardy of becoming realized.
Yeah, there are some things that really do bother me, and a lot of that revolves typically around what our elected officials will end up doing in Washington, D.C., because there is a lot of lobbying that goes on from different areas. And while the healthcare spend is a big concern, rightly so, for the elected officials, they tend to focus on where they can cut back on spending. And if it is not done right, that can really impact the access to care to patients. That really bothers me. And of course, the drug industry is where a lot of the money is being spent, not just the healthcare delivery. It's not just the hospitals and physicians where you're spending the money. Majority of that goes into drug industry. So, but they do have a pretty, big lobby. So I hope that the decision makers look at the final impact to the patients, keeping the patients in the forefront and make those decisions. So I'm hoping that we in healthcare, especially clinicians, can help drive that.
Are there specific initiatives you're keeping an eye on that are top of mind, or just generally speaking?
I'm speaking generally. I mean, each healthcare system has its own areas that they would like to keep an eye on. As far as I'm concerned, we are a healthcare organization who doesn't belong to any special category and receives any special kind of benefit. We are a small independent hospital trying to do our best, and we have to look at all options. So it's uh, it's challenging, but I do see a path forward, and we can certainly do that. That's why I say I think change is inevitable. We just need to be prepared and be adaptable for that change. We can always, overcome that.
Awesome. And then one last question, and then I'll let you go and be respectful of your time. Is you've done a lot of amazing things since you started. I know, personally, you brought telemedicine. You've done a lot of staff and staffing changes. You made a lot of impact, both as CMO and as CEO. What are the top one or two things you're most proud of in terms of your impact at Liberty and in the surrounding community?
Hmm. It's well, it's not always about me, um, but I do feel that having people develop trust in leadership, that's extremely important. And many times we ask people to do things that they aren't always ready to do it. However, if they trust you and keeping the integrity and being as open as possible and getting to people to understand the significance of what they're doing, I think I've been able to do that for the most part in the last year. I'm proud of that. I don't want to lose that. And I think uh, if if we give importance to people rather than a whole bunch of other things, the buildings and structures and all that, I think we can make a lot of things happen. And COVID helped in getting that done. And the people here, the culture-wise, the Liberty is so well known for the personal touch that patients and families get. And I think we should be able to continue that even when we grow. And that's what a lot of larger systems lose. And I don't want to lose that. So if we can continue to grow, I think I'll be very happy and proud we've been able to do that here in Northland.
Fantastic. Well, thank you so much for your time today. I really appreciate you taking your morning to chat with us.
Yeah, thank you. Thank you for inviting me. It's an exciting podcast, and I'm thrilled to join very many of your other speakers who are very well known and spoke very highly. So thank you.